Okay, so now I'm going to talk through going through the vital signs demonstration. Um, so first I would identify the patient with two identifiers, their name and date of birth. I would verify the provider's orders, um, ask if they have any allergies or in any pain. Um, I would place all my supplies on a clean surface. Then I would inform the patient on what we're doing it and why we're doing it. Kind of ask them to breathe like normally or talk as they normally would, and answer any questions that they might have. I'd make sure to ask if they have smoked before coming in, if they recently had something hot or cold to drink, if they had any nail polish on, and if they would, I would remove it. And if they had a mastectomy, and on which side. So then at that point, I would clean all my materials, disinfect everything. Then I would assess for pain, ask if they're having any pain, where it's at, the quality of it, if, if there is any pain, I can't think of the word. Oh, if it spreads to a different part of the body or not. Then I'm going to do check the temperature orally. So I would place a disposable probe cover over it and place it underneath the tongue, and then hold it there until it beeps, until it's ready, and then I'd read the temperature and dispose of the probe cover into the trash can. And then I would do the tympanic temperature. So I would put a probe over the thermometer, and then I would put it in the patient's ear, and then I would pull back, up, and out, and then wait for for it to be done read it, and then dispose of the cover. And then I would move on to the axillary underneath the armpit. I'd put a probe cover over that as well, place it underneath the patient's arm, and have them hold it until it's done reading. Then you would lift your patient's arm, read it, and then dispose of the cover. And then I would do the temporal temperature. So at this point, I would press the button, place on the patient's head, all the way over the hairline, lift up with the still press and put it behind the ear, and then take it off the skin and unpress the button, and then read the temperature. And then I would assess the radial pulse. So I would use 2 fingers and assess for 30 seconds, and multiply it by 2 if it is normal. If it's not, then you would count for 1 full minute, and then you'd be assessing the rate, rhythm, and strength, and if it's regular or not. And then I move on to respirations. You would just watch the patient's chest and count for 30 seconds and count, or in times by 2. If it was irregular, then you would count for additional 30, or for a full minute. So then I would do the blood pressure, the 2-step method. So first I would locate the brachial artery, palpate for that. Then I would put the blood pressure cuff on while still having my finger on the brachial artery. I would inflate the blood pressure cuff, and then feel until you don't feel a pulse anymore, and then you can deflate it. And then once that is done, you want to make note of where you stopped hearing the pulse at. So then you're going to put your stethoscope on and put the diaphragm on the brachial artery and listen. So you're going to inflate it to 30 millimeters of mercury over where you stopped and didn't hear the pulse. And so then you're going to be assessing for when you first hear the pulse, that'll be the systolic, and then when you don't hear a pulse anymore, and that'll be the diastolic. I think that's all with the blood pressure. Then I would move on to oxygen saturation. So at this point you would put the oxygen saturation on the finger, let it read, and then at this point you can clean off all of your other and when it's done, you'll take it off, read it, and then you can clean off your supplies as you get the stethoscope, your thermometers, and oxygen saturation stethoscope. Perform hand hygiene. Make sure the patient is comfortable in the lowest position of the bed, the side rails up. Call eye in reach, and perform hand hygiene again. And then you make sure after that you document all of the readings, if anything was abnormal or normal, how the patient participated, if they refused any vital signs, and any teaching that you may recommend for your patient, and sign an initial.